Hi, my name is Ariana. I'm going to be your nurse today. Could you please state your name and date of birth?
Peter Baskina, December 13th, 1994.
And could you please state what season it is?
Spring,
And what year is it?
2020.
Patient is alert and oriented ×3. I'm going to now ask you 3 subjective questions. What kind of exercise do you do?
Primarily weightlifting.
And have you ever had any trauma to your head, bones, or muscles?
No,
And do you drink alcohol or smoke?
neither.
Okay. So now I'm going to assess your positioning and everything. Patient is upright and comfortable and relaxed. Arms relaxed on his sides. He has facial features that are symmetrical with movement. Skin is intact with no visible lesions. Skin pigment and color and tone are all even. And breathing is unlabored and quiet. So now I'm going to have you please lie down so I can inspect your abdomen. Contour is flat and everything is symmetrical. His umbilicus is without a hernia and there's no inflammation, as well as being inverted. He has normal breathing patterns with, for what males have, they show some little movement in their abdomen. And now I'm going to listen to your breathing and your abdomen. Sounds are present with high-pitched gurgling, and they are within defined limits. I'm now going to do a light palpation. Muscles are relaxed, and there is no tenderness noted by his facial expressions. Now I'm going to do a deep palpation. Do you have any pain with this?
No.
So there's no noted masses or tumors, and there is no pain as noted by the patient. Now I'm going to have you sit back up and we're going to start the neurological exam. So could you please walk forward and then walk backwards? Patient's gait is balanced and symmetrical. And now I'm going to have you read this.
Bon Secours Memorial College of Nursing.
CN2 is intact. Now I'm going to use my pen light. Please keep focused on me. Pupils are equal, round, reactive to light. Please follow my finger. CN3, 4, and 6 are intact. Could you please bite down? And could you please put out your hand and close your eyes? Can you feel this?
Yes.
Okay. CN5 is intact. Could you please now raise your eyebrows and smile? CN7 is intact. Could you please now, his hearing is good based on my assessment of him following directions. So CN8 is intact. And then could you please stick out your tongue and say ah? I'm going to use my light. Could you please say all again?
Okay.
And seeing 9 and 10 are intact. Could you please press down or up against my hands? Seeing 11 is intact. And could you please put your tongue side to side and out? And seeing 12 is intact. We're now going to move forward to the musculoskeletal system. Could you please sit down? And could you raise your arms side to side, front, and then up, okay, and down, okay. Upper extremities are normal range of motion. Could you please put your arms back out and put your elbows up? Thank you. And could you please put your wrists down and up? I'm going to bend your fingers back. Relax. Okay. Thank you. And could you please grip down? Now I'm going to put my 2 fingers here and please squeeze them. Thank you. Grip strength is normal, and wrist, elbows, and hands range of motion is normal. Now could you please kick forward? And could you point your toes? Put your feet down. Could you flex your feet? And can you please stand back up? And I'm gonna have you go side to side. Yes. And go forward. And could you please just bend down for me? And I'm gonna check his spine curvature. Everything in his spine is aligned. His lower body and extremities are all normal range of motion. His feet are normal range of motion, and knees have good flexion and extension with no hyperextension.